Hi guys, so welcome back. I'm here again to discuss about the next set of questions. We had discussed till question number 50 in the last session. I'll be uploading the questions in parts, so please make sure that you watch all the parts. So in this session, I'll be discussing a few questions. Yeah, these are all morning session questions which I appeared in the morning session. So all these questions which I'm discussing are from the morning session. Okay. So next question is 51st question. Okay. So 51st, the 51, question number 51. Book test is used for which nerve? So median nerve, ulnar nerve, radial nerve, all were given. So the answer is ulnar nerve. This is a basic anatomical question. So I think most of you will be knowing. It's a direct question. Next one, 52, question number 52. HMP shunt pathway provides. Answer is NAD pH. The next question. A patient. This is a case scenario. A patient who is unconscious came to EMS department with decreased SpO2. How will you manage the patient? So this is a multiple answer question. So we had to choose the multiple answers. The option is IV fluids, chest tube insertion. It's a multiple answer question which is to be put in order. So I think the order is IV fluids, chest tube insertion, ET tube insertion, and CECT. Moving on to the next question. An image was given which showed crumpled tissue paper appearance. So this is seen in Gaucher's disease. Next question. A patient came with high leukocyte count. The leukocyte count value was also given. I don't remember exactly, around it was quite high, some 80,000 around. I don't remember exactly, but it was a very high number. Leukocyte count, and basophilia was present in the patient. So what is the condition? Condition is CML. Next question. Selenocystin is present in which enzyme? Answer is glutathione peroxidase. Next question. An image of few images were given and it was multiple correct answer question. So the question is, what is true regarding neurocysticercosis? So 2 correct images were there. Along with demonstration, along with a sentence was there as an option. Demonstration of parasite in muscle. Okay. The next question. Absence of graft versus host rejection with bare lymphocyte is due to deficiency of. So this question is a little confusing. I had marked an answer, but I am not so sure about it. T cell was an option, then MHC1 and MHC2. These were the options. So it's a little confusing. Since I'm not sure, I'm not telling the answer. But if anyone knows the answer, please let me know. Then the next question is mechanism of action of sildenafil. Answer is it decreases CGMP. Moving on to the next question. Which of the following will produce high anion gap metabolic acidosis? So the answer to this is salicylate poisoning. So when we study metabolic acidosis, we study it in mud piles. So the S in mud piles is salicylate. So mnemonics, at times mnemonics helps. Then the next question was lithium dosage, which is to be given for mania, acute mania, given for acute mania and long-term prophylaxis, and for long-term prophylaxis is, so there were two options which are a little confusing. One of them is 1.4 to 1.8 and the other one is 1.6 to 0.6 to 1.5. So on a long term, we usually give 0.4 to 0.8, but for acute mania, we'll be giving 0.6 to 1.5. So since both the things are given together, I'm a little confused. I had marked an answer. I'm not discussing with you guys. If someone is sure about the answer, please mention. Moving on to the next question. Next one is a match the following type of question. So I knew only two answers, and from the two matches I could get the correct option. So one of them is kleptomania, which most of the students will be knowing, urge for stealing. And the next one was mutilomania. As the name suggests, urge to mutilate animals. So the options were very simple. So even if you know one or two of the matches, you will be able to answer. Another question was, it's from forensic. Spanish windlass is, so the options were Bansdola was given, garroting was given, few others were also given. The correct answer is garroting. Moving on to the next question. An image of an X-ray was given. With scissor in abdomen. So the patient can sue the doctor under res ipsa loquitur. So the next question is an image showing Henderson-Patterson body was there. So that is molluscum contagiosum. Next question, question number 66. Which of the following is not a criteria for SIRS? So the answer to this is SBP less than 90. So this one is also it's easy to rule out. It's basic, so most of you will be knowing. Next one, 67th question. A female with neck swelling, moving with deglutition, and invading strap muscles is present. Also, an histological image was given which showed orphan nuclei. So the answer is papillary carcinoma thyroid. Moving on to the next question. Refsum's disease is due to? The answer is defective alpha oxidation of fatty acid in peroxisomes. Okay, the next question. All of the following are true about an injury to pterion except. So the questions were discussing about the bones which were involved in pterion, and the other options I exactly don't remember, but we could rule out. It's a very basic question. If you just think you'll be getting the answer. The answer was meningeal carcinoma. I reached the answer by eliminating the other answers. Next question was postmortem image of a skull was shown. So it was an injured skull of a skull injury was shown, and it was asked what type of hemorrhage is it, like what is seen. So the answer was subdural hematoma. Moving on to the next question. A person having a palpable abdominal mass came to the clinic. Which of the following is true? So the other options are all false. So I basically don't remember. The correct answer is it can be easily differentiated from symptomatic gallstone. So the next question is, an image of a lesion was shown. Identify the lesion below. The answer to this is Gordon's papule. An image of Gordon's papule was shown. Next question. In which of the following conditions thrombolysis should not be given? So the answer to this is BP more than 185 by 120. This is the correct answer. And moving on to the next question. Which of the following is not a component of damage control surgery? I am not very sure about this answer. That's why I'm not telling you the answer. The options were arteriovenous anastomosis, then preventing further injury, then other one was to prevent further contamination, and one more option was there. I had mentioned an answer. I'm not very sure about it, so I'm not. I think it's better I don't discuss with you guys. So moving on to the next question. Before thyroid surgery, which of the following is given to patient? Answer to this is potassium iodide. So I have discussed till question number 25. Hope you guys are watching my videos. Please watch part 1 and 2 as well. I'll be uploading the next part soon with the remaining set of questions. I'll try maximum to upload all of the questions, probably nearly 200 questions, or like at least 180 to 190 questions I'll be uploading. So guys, please keep in touch and please subscribe my channel and go through the questions. All the best. Thank you for watching.